Welcome to Substance Abuse Treatment for Persons with Child Abuse and Neglect Issues, based on Treatment Improvement Protocol 36. This is brought to you by allceus.com. Many people with child abuse issues develop addictions. Child abuse and neglect is common in addicted families. Child abuse is often related to the child's lack of access to physical and emotional safety. That is, because the parents are unable to provide physical or emotional safety for the child, they often end up in situations in which they can be abused. During the screening and assessment process, it's important to consider the fact that current substance use and the quality or length of abstinence may be related to the history of abuse and trying to escape from the abuse. It's important to consider the person's commitment to the treatment and recovery process, not only for the abuse issues, but also any depression, anxiety, or addiction issues they may have. In people who have co-occurring mental health or substance use issues, there is a high risk of relapse when they start exploring the abuse and trauma issues. So someone who is depressed, who may be pulling out of that depression, who suddenly decides, I really need to work on the abuse issues, may have a relapse of their depression. Likewise, substance users may return to their addiction preference. Clients should evaluate their own readiness to confront the child abuse. It's not for us to say when they're ready or when they're not ready. It is, however, our obligation to make sure that they've got a support system in place. You don't want somebody, especially who is recovering from substance use issues, to be in early recovery, in outpatient, with no sober social supports. That just sets them up for relapse. They need to have sort of all their ducks in a row. They need to know that this is going to be an emotionally draining process, and they need to minimize any external stresses, like they don't want to take on a new project at work or don't want to do it right before the in-laws come to visit. And they need to make sure they're ready to set aside time to work on themselves and the issues, and they have supports when necessary. This can include sober social supports, relatives that are supportive and helpful, friends, local crisis centers, local rape trauma groups. There's a variety of different places people can find support. With regard to the setting and the timing, people need to be in a non-threatening environment. It's important to develop trust and rapport with the person first. You're not going to meet somebody for the first time and say, so let's deal with those child abuse issues. No. You're going to develop some rapport over time. During this process, you're going to help them develop coping skills to self-soothe in a healthy, positive way, and learn how to control their emotions in a healthy, positive way. So when they start to encounter a crisis point, they can de-escalate themselves. It's important to be sensitive to cultural issues. Not everybody is going to speak about it right away. We are just now starting to really realize the scope of child abuse on young boys, because culturally that wasn't something we really talked about as much for some reason as sexual abuse on young girls. Be sensitive to issues of race, ethnicity, religion, and what sort of underpinnings the behavior may have. You don't want to make sweeping generalizations about people, for example, who live on a communal farm, just assuming that something bad is going to happen or something unhealthy is existing. It can be a very healthy, functional environment. And it's important to repeat screenings for a history of abuse at quarterly reassessments, because you know what? Most people don't tell you during the first time through, or the second. Sometimes this is because they don't trust you and there's too much shame involved. Sometimes it's because they just don't remember. And as they start to sober up or come out of their depression, all of a sudden it hits them like a ton of bricks. It's important, again, to kind of ask about things, because people who were sexually abused or physically abused may have blocked out some of it. So if there are behaviors that really don't make any sense that they are exhibiting today, you might look back and say, is there a possibility that something happened? Now, most of the time this is not true. Most of the time people are going to go, no, nothing happened to me when I was a kid. But if you think it might be there, sometimes the consumer is waiting for you to broach the subject because they're too ashamed to bring it up themselves. It's important to learn and understand ways in which childhood abuse and neglect can affect adult feelings and behaviors. When a child is experiencing abuse or neglect, they often are in a position where they cannot survive on their own. A child has to somehow try to figure out why this is happening to them from somebody who is supposed to love and take care of them. It doesn't make any sense. So the child does the best they can to integrate it into their schema of how the world works. Generally, they integrate it by saying, I must be bad. If this is happening to me by this person who is supposed to be good and caring for me, then I must be bad. These feelings are often carried into adulthood, where people have not rectified that discrepancy and realized that the abuser was overstepping his or her bounds and behaving in ways that were not appropriate, and that the child was not bad. The child was in a helpless situation. As therapists, we can help identify individuals who appear to exhibit symptoms, and we can help people understand that you're behaving this way, you're reacting in this way, maybe because that's how you survived until now. You're abusing substances now because the only way you got through your childhood was because you got drugged right before you were assaulted. It's important to identify the trauma-related treatment needs of individuals. What I mean by that is some people want to go back and re-explore the trauma and identify every single possible thing that reminds them of the trauma, deal with it, try to figure out why it happened, whether it happened, what parts they were responsible for, which were none. But they really want to explore this. Other people don't feel that way. They want to identify how the past is affecting them now and figure out ways to deal with it in the present. But really exploring the hows, whens, wheres, and whys isn't something that's on their priority list. So it's important to let the person decide exactly how they're going to approach the trauma. It's also important to help them identify that they're going to need social support. They may need a short course of antidepressants or anti-anxiety medication. This is depending on where the person's starting from. If they are at great risk of a relapse into depression or anxiety, it may be appropriate to prepare them that they may need to talk with their doctor about increasing their medication. Some people who've had extensive abuse and trauma, especially those who are currently in recovery for substance abuse, may need a short-term inpatient stay in order to get through the initial crisis to prevent a relapse. Not all. It's something to consider, though. It's also important to provide or coordinate appropriate treatment services that will help meet clients' treatment needs. For some people, if they don't go into inpatient, they may still benefit from having a case manager work with them, or a specialist, or whatever you call it at your agency, who can help them figure out and plan the day-to-day activities in order to keep their life moving along during the initial crisis. So help them make lists of what needs to be done, help them figure out how they're going to get their groceries, help them figure out what the next right thing to do is. There are some issues that the therapist needs to be aware of. Sexual abuse is often transmitted intergenerationally. That means that Generally, somebody in prior generations has been abused, and this is a pattern of behavior that is seen throughout the family. Adults and children, survivors alike, often exhibit self-blame for childhood abuse. This is something that needs to be addressed, and the person needs to figure out where they can make sense of what happened. Many people may restrict admitting that they were abused due to confidentiality and mandated reporting issues. They don't want to tell because then they're going to have to report it, or you're going to have to report it, and they don't want to go there. So they'll just be quiet. And you also have to be aware that you have a potential for creating a crisis. It's like ripping a scab off a wound that is just starting to heal. You need to be aware that if you rip that scab off and the person starts gushing, you've got to be able to stop what's going on and help the person get control again. If not, you need to have a backup plan. If you have somebody who has issues with extreme impulsivity or anger management issues, be prepared to Baker Act. The benefits of dealing with the abuse include stopping the cycle. Now, just because someone was sexually or physically abused as a child doesn't necessarily mean that they will sexually or physically abuse. They may only, quote unquote, emotionally abuse their children because there's a part of them that's envious or jealous that their children are having a better life than they did. Now, when you say it out loud, it really sounds ludicrous, but when you go back and you look at survivors, there's often, to coin a term, a sad inner child that is still acting out in some ways. So if you can help them identify those primitive feelings, reactions, and defenses, they can be much better, well-equipped parents. Dealing with the abuse decreases the probability of relapse. It improves the client's overall psychological and interpersonal functioning. And as a manager, director, I also have to point out it's going to improve program outcome. If you help people deal with these issues, your recidivism rate is going to drop, which is going to look better in your state stats and your outcome measures. When you're conducting an assessment, it's important to remember that no single standardized tool is comprehensive. Information that should be obtained, and this is up to your discretion, some of these may need to be tabled until later times, but it's recommended to look at what the client thought about or felt during the abuse, how the client understood as a child what was happening to her, and what she thinks about it now. How did she understand it back then, and now as a grown-up? Looking back on it, does she still think about it and feel about it the same way, or is there a difference? People need to identify the feelings most closely associated with the abuse experience. These are going to be some of your primary triggers for relapse. It's important to understand how the client thinks and feels about how the abuse has affected his or her adulthood and current substance abuse or use patterns. It's important to understand how he or she deals with the after effects of the abuse. When they see stories of abuse on television, when they're reminded, when they have a flashback, when they're dealing with their own children, how is it impacting them now? And it's important to understand the client's coping strategies and their current effectiveness. The key here is their current effectiveness. We can use a whole range of coping strategies, but if they don't work, what's the point? When you're working with children who've been abused, you want to look for depression in the child, anxiety, dissociative responses where they're sort of splitting, they're talking like a fly on the wall, or blacked out time frames where they tell you, I can't remember what happened. I can't remember what happened last Christmas or last weekend. Aggressive behavior or other acting out behavior, including early sexual activity or overly sexualized behavior. Physically abusing or harming pets or other animals, or other destructive behaviors, and this can be self-destructive, such as engaging in very risky behaviors or self-mutilation, or other destructive, destroying property and just acting out all that rage and aggression. Poor relationships with one or both parents. Attachment disorder, which leads to a difficulty trusting others. Excessive passivity or passive-aggressive behavior that, yeah, whatever, do to me or with me what you will, I just don't care anymore. Or excessive nightmares, extreme fear of the dark, phobias that are developing that seem to be in reaction to what happened or is happening to them. Family of origin characteristics include parental substance abuse. Substances are often disinhibitors, which people tend to behave in ways when they're high or drunk that they wouldn't necessarily behave if they were sober. Parental substance abuse also sort of incapacitates the parent so other people can take advantage of the children or of the parents. Battering within the family. Just because Jim Bob hits his wife doesn't mean he doesn't hit his kid and his dog too. Involvement with Child Protective Services or foster care. If a child was taken out for some reason, chances are there was some level of abuse. It may have been physical, sexual, or emotional, or all of the above. If there's placement with foster parents or relatives, if the child reports severe discipline during childhood, and everybody's level of severity differs. It's important to put it in context of what was going on, whether the child was truly injured, and what the emotional impact was. And a history of traumatic separations and losses. One example of this is maybe someone who is widowed when their children are very young, so the female child becomes the surrogate wife, or the male child becomes the surrogate husband. From a developmental perspective, we can often understand adult behaviors of children who were abused in terms of what developmental crisis was thwarted. Erickson says that as we work through these developmental crises, we have to work through one to move to the other. So if a child is abused early in their development, their psychosocial development is thwarted at that stage until we can remove the blockage or help them resolve the crisis or whatever you want to say. A lot of this is able to be seen when you really look at it from a developmental perspective. Infants go through the trust-mistrust stage where they try to develop a sense of the ability to trust caregivers to meet their needs and trust themselves. If they cry because they're hungry and their caregiver puts them in a blanket, then they're saying, well, you can't trust yourself. You're not really hungry. You're cold. If they cry because they're scared and their caregiver feeds them, again, they're learning to not trust themselves. If they cry and their caregiver doesn't respond at all, they're learning they can't trust anybody. If they are infants and they are being assaulted, they learn that grown-ups, big people, cause them pain and can't be trusted. Resolution of this crisis results in people having a basic sense of hope and a basic sense of trust in themselves. If you can't get through this, you're not going to be able to build on anything else. In toddlers, they want to master their physical environment. They want to develop a sense of autonomy. If they don't, they develop shame and doubt. So let's think about this. When children are toddlers, they need to develop a sense of personal control over their physical skills, their body, their environment, and a sense of independence. In order to do this, they need to be able to go out, try things, and go back to a safe place, that home base. Now, if home is not safe, then they're kind of left out there in loopy land. Success leads to feeling of autonomy, and failure results in feelings of shame and doubt. If they don't have a safe base to start from, they're not going to feel safe going out and exploring. If they are unable to master their physical environment and be safe, then because they're being abused, they're not able to maintain their own physical boundaries, they're going to have a sense of shame and doubt about whether they're competent or able to exist as human beings. They start losing their will to fight, losing their will to live, so to speak. And sometimes they start losing their hope and really regressing. Preschoolers develop initiative versus guilt. During this age, they're developing their conscience and their sexual identity. Children need to begin asserting control and power over the environment. Success in this stage leads to a sense of purpose. Children who try to exert too much power experience disapproval, resulting in a sense of guilt. Now, let's think about it. In a family, in a situation in which a preschooler is being abused, and they try to exert their power to protect themselves, what happens? They're punished. They experience disapproval, resulting in a sense of guilt. So they tried to protect themselves, and they ended up feeling guilty about it. If the abuse doesn't start until the person's school-aged, then it interferes with industry versus inferiority, or a development of a sense of competence. Children at this age need to cope with new social and academic demands. An inability, we talked earlier about children who are abused tend to display overly aggressive or overly sexualized behavior. So at this age, if that behavior's been reinforced and they're trying to develop a new social circle, it ends up backfiring on them, which leads to a sense of inferiority. So as adults, we have to help people look at what age the abuse started and assess, and I'm not saying it happens every time, but assess whether their development was thwarted in that area and what they need to do in order to regain a sense of hope, will, purpose, and competence. Adult characteristics of children who are abused include anxiety, depression, low self-esteem, an external locus of control. They have no control over anything. Everything just kind of happens. An inability to create healthy relationships, emotional instability, an unstable sense of self. They're generally chameleon-esque, as I say. They try to blend in. They try to make everybody happy. They try to be whatever you want them to be, because that's how they've survived till now, by not making waves. And sexual behaviors may be at one extreme or the other. General treatment recommendations. Counselors should exhibit unconditional positive regard, a non-judgmental attitude, and sincerity. Duh, that's Counseling 101. But it was in the tip, so we're going to put it in here. Providers must be sensitive to their clients' cultural issues and how they interact with clients' child abuse or neglect history. Telling people to just write off a certain part of their family may not be culturally appropriate. You need to work with the client to help them figure out what sort of a resolution is going to feel right for them. In the initial crisis that often follows a disclosure, the counselor's most important task may be helping the client with affect management. All of these emotions that have been bottled up for so long often come rushing out. So helping the client figure out how to moderate those so they don't feel like they're going crazy is going to be important. Helping the client deal with the waves of emotion that come over them is going to be important. Oftentimes after an initial disclosure, people also start having flashbacks. Helping them figure out how to deal with those flashbacks and stay in the present moment is going to be important. One of the things that I've found most helpful in my practice working with people is having them keep, a lot of the people I've worked with have been women, so scrunchies on their wrist. The scrunchie doesn't have a rubber band that's going to leave welts or leave marks, but if they snap that once, or maybe even twice, it helps jar them back to the present moment. That way they can get out of that flashback and start using their positive self-statements in order to get through that moment. Clients who suffered severe childhood abuse may need to be reassured that they're in a safe environment and will not be abused in the present. Don't make this assurance if that's not true. If your consumer is going to go home to an environment in which her husband is not supportive, or worse yet, her husband is abusive, don't tell her she's in a safe environment. Ideally, you'd help her get to a safe place while she's dealing with this. That way she can make better choices and better decisions in her future relationships. Do not make promises you cannot keep, and do not tell people that everything's okay if it's not. That's just setting yourself up to be made into a liar and to break the trust. Consumers may need to be taught techniques to stay focused in the present. Like I said, the scrunchie does pretty well. A worry stone. My husband used to get really mad at me because I tend to be a high-strung person, and I had a USB drive that was one of those that you kept on your key ring, and I would hold on to it and I would flick it in and out and in and out and in and out and in and out whenever I was, sitting still or in a meeting or whatever, and I eventually broke it because it's not meant to be flicked in and out like a worry stone. But I digress. Finding something that they can do that's not destructive. Biting their nails, not helpful. Self-mutilation, not helpful. Using a stress ball. If they have carpal tunnel, this is not going to be something they can do. If they don't, it might be something that's useful. Some clients may require medical supervision in order to deal with their feelings of rage, anxiety, depression, or suicidality. This is the minority, but do be aware that sometimes the memories and the feelings can precipitate such a crisis that the person either wants to harm themselves or they want to harm the abuser. Clients with past trauma should be reassured in treatment that they have the capacity to deal with traumatic memories or related destructive behaviors. In our treatment facility, we talk about dealing with the present and figuring out how they're going to deal with stuff as it comes up, rewarding any positive efforts to deal with stress, and then building on those. In behavior modification, we call it shaping. Counselors must carefully pace the client's treatment by monitoring anxiety and depression levels and by taking other cues directly from the client. Don't tell them you're going to go through a course in 8 weeks and they're going to feel better. You want to be able to pace the consumer at a pace that keeps them engaged, but also doesn't precipitate an unnecessary crisis. One thing I found out early on in substance abuse treatment, and the same can be extrapolated to dealing with survivors of abuse, if you have a workbook or a book on dealing with a topic that's like an 18-week journey through recovery, don't give them the whole book at once because they're going to read it from cover to cover. Give Xerox or do something so they only have access to what you want them to focus on for that week. And that will help them not only more thoroughly go through the stuff that you want them to do for that week, but it will prevent them from going too far and suddenly getting overwhelmed in stuff that they weren't prepared to handle. Counselors should search for and apply any available leverage to help clients endure the short-term pain until some treatment benefits can be realized. Cognitive behavioral therapy, always good. A short course of antidepressants or anti-anxiety medications, sometimes good. A short course of residential treatment may be necessary. Whatever they can use to get them through the short-term pain is kind of like childbirth. When you come out the other end, it's going to be great. But going through the initial or the actual birthing process, you need whatever you can muster to get through that initial pain. Have people devise a plan and identify what resources they have. This takes a lot of energy. What energy demanding things can they give up for right now? Do they have to be doing carpool? Do they have to be coaching Little League? Do they have to be doing whatever? What are the have-tos that they need to accomplish, and what can be delegated or eliminated for a short period? Clients must be engaged in a way that will give them hope and increase their beliefs in their own power to create a new life. Hope. Hope that this isn't going to destroy them. Hope that they have the strength to deal with it on their own. Hope that they can stop the cycle. Whatever gives them hope, whatever makes this process meaningful to them. Why do they want to do this? That is your motivation, and that can be used to create hope. The mere act of acknowledging a history of abuse can be tremendously healing and can lead to change, or it can be highly disturbing. You need to be prepared to respond to either reaction, and it can vary between days, between sessions. Again, it's important to teach consumers ways to self-soothe so they don't end up spiraling out of control into a crisis, or worse yet, abandoning treatment when they've just uncovered a bunch of stuff. The counselor must validate the client's experience by recognizing the issue, refocusing the treatment, and addressing the issue. If a client is motivated to work on the abuse issues, we know that abuse affects pretty much every area of their life. So while you may not be directly focusing on the substance abuse or directly focusing on the depression, by dealing with the abuse and the repercussions, you are tangentially dealing with those. It's important in each session, if you have somebody who is co-occurring disordered, to address all of the issues. So you talk about the abuse for a while, and then you kind of segue into, okay, now how is dealing with this impacting your depression? How do you think this history of this abuse sort of caused or exacerbated your depression, and what can we do in order to help mitigate that now? Bring it all together. People need to understand that everything impacts everything else. So as they're working on their abuse issues, their depression may get a little bit worse. It's important to focus on helping them survive that little dip. For victims of abuse, the process of reattaching, or even attaching for the first time, to other people, to a community, or to a spiritual power has tremendous therapeutic value. For the first time, many consumers realize they're not all alone, and there is somebody or something they can trust. The first step is learning to trust themselves, but they also need to learn to trust and to reach out to other supports, whatever those other supports may be. Counselors should prepare clients for treatment by helping them realize that their history of childhood abuse or neglect has contributed to some of their errors in thinking, behavior, and decision making. Now, we can't blame everything on the abuse. That's just using it as a scapegoat. People do need to take responsibility for their present behaviors, but they also need to understand that the past has made them who they are today, and they need to use who they are today and their current strengths to become the person that they want to be. It's important that they realize that they self-medicated with substances in order to avoid dealing with emotions, and that they are not alone, and that there are resources there to help them. As I said earlier, treatment can either focus on how past events impact the person today, Or they can focus on understanding and accepting the past. These are philosophical treatment differences that your client is going to need to figure out for themselves what they think is going to be most useful to helping them deal with their prior trauma. Abuse survivors may not be able to handle the group therapy process until they're able to deal effectively with their attachment issues. If they don't trust anybody, they're not going to open up in group. Likewise, they're not going to be there and be able to be supportive for others in group. So putting them into a group is sort of a futile process at best. Finally, it's a delicate matter to discuss past abuse in the presence of family members who participated in or were present during it. When and if such a decision is made, the counselor must bear in mind that he or she does not and should not have the role of confronting the perpetrator or perpetrators. If the client feels a need to confront the perpetrator, it must be done in a controlled environment, and the therapist is there to support the client, but not to partake in the confrontation. In summary, childhood abuse can impact people throughout their lives. Abuse not only impacts the survivor, but it also has repercussions for partners, family members, and relationships with friends. Many dysfunctional behaviors can be reframed as primitive ways a child used to deal with extreme stress. Clients, as adults, can be taught more sophisticated ways of dealing with the stress. Clients must be in charge of their own treatment in order to reclaim a sense of personal power.